sharp leg cramp at 2 a.m. wasn't random, but a warning your body's balance is off. For millions of seniors, these painful spasms seem to come out of nowhere. But they don't. Behind every cramp is a cause, often linked to something as simple as how you hydrate, move, or eat before bed. And here's the catch. Ignoring these signals could lead to bigger health issues down the road. Are you missing the subtle signs your muscles are begging you to notice? In this video, we'll break down natural fixes, smart daily habits, and serious warning signs you need to watch for before a minor cramp turns into a major problem. Stick around as we reveal 3 powerful natural remedies that bring real relief. 1. Mustard. Yellow mustard, made from mustard seeds, vinegar, and turmeric, acts quickly to stop leg cramps through its effect on the nervous system. The strong, tangy flavor activates sensory receptors in the mouth, especially those sensitive to bitter and acidic compounds. These receptors send signals to the spinal cord, triggering a reflex that inhibits the abnormal nerve impulses responsible for muscle contractions. This immediate neural response interrupts the cycle of cramping and resets muscle control within minutes. It bypasses the need for digestion, which makes it especially helpful for seniors who experience sudden nighttime cramps and need quick relief without waiting for pills or drinks to take effect. Mustard also contains compounds that influence acetylcholine production, a neurotransmitter that tells muscles when to contract and relax. As people age, the balance of neurotransmitters may shift, leading to miscommunication between nerves and muscles. Acetic acid in mustard has been shown to increase acetylcholine levels in some scenarios, which may explain its use in calming overactive muscle fibers. When the nervous system receives the right level of acetylcholine, it can better control the contraction-relaxation cycle. This mechanism supports the idea that mustard doesn't just mask the pain. It targets one of the core problems behind muscle spasms in aging muscles. The turmeric present in yellow mustard adds a deeper layer of benefit for older adults struggling with inflammation-driven cramps. Curcumin, turmeric's main active compound, has been linked to lower levels of inflammatory markers that irritate muscle fibers. Inflammation can keep muscles in a semi-contracted state, increasing the chance of sudden spasms. By reducing low-grade inflammation over time, curcumin may help muscles remain more relaxed and less prone to painful contractions. Seniors who regularly deal with stiffness or muscle fatigue may find that mustard provides both fast-acting and long-term relief through this multi-layered chemical activity. Another important aspect is the presence of vinegar, which improves mustard's effectiveness. Vinegar contains acetic acid, which not only stimulates nerve receptors, but also helps the body use minerals more efficiently. Muscle cramps often involve a deficiency or imbalance of minerals like potassium, calcium, or magnesium. Though mustard itself doesn't supply high amounts of these minerals, the acetic acid may help the body absorb them better from other foods. For seniors with slower digestion or reduced nutrient absorption, this supportive role makes mustard even more useful. It's easy to keep a teaspoon at the bedside or carry a small packet when traveling or walking, making it a reliable and accessible remedy. 2. Epsom salt bath. An Epsom salt bath works through a combination of mineral absorption, muscle relaxation, and improved circulation. The primary component, magnesium sulfate, dissolves in warm water and can enter the body through the skin. For seniors whose digestive systems may not absorb oral magnesium well, this transdermal method offers a valuable alternative. Magnesium plays a central role in relaxing muscles by blocking calcium channels, which prevents muscles from contracting too tightly or frequently. When absorbed through the skin, magnesium reaches local tissues quickly and can calm down irritated muscle fibers, reducing both pain and tightness during a cramp episode. Warm water itself is an essential factor that enhances the benefits of Epsom salt. The heat causes blood vessels to expand, improving circulation in the legs and feet, where cramps are most common. This increased blood flow helps remove byproducts like lactic acid and brings oxygen-rich blood into the affected area. These changes make the muscle environment more balanced and less likely to trigger spasms. For seniors with circulatory issues or those who spend long hours sitting or lying down, poor blood flow often worsens the frequency and severity of cramps. A warm Epsom salt soak can directly target these issues without requiring physical exertion. Epsom salt baths also help reduce fluid buildup in and around muscle tissues. Cramping is sometimes caused or worsened by swelling, especially in the lower legs, where fluid tends to pool due to gravity and poor venous return. Magnesium sulfate has osmotic properties, which means it can pull excess fluids out of tissues and reduce the internal pressure that leads to nerve compression and cramping. Seniors dealing with edema or fluid retention can benefit from this cleansing effect. It not only soothes the muscles, but also helps drain out accumulated waste products, making future spasms less likely. Beyond physical relief, Epsom salt baths support nervous system recovery and stress reduction, which indirectly benefits muscle health. Chronic stress raises cortisol levels and may deplete the body's magnesium stores, creating a higher risk of cramps. Taking a quiet, warm bath with Epsom salt encourages relaxation and lowers stress hormone levels. Many seniors find the ritual calming and restorative, especially when done before bed. Regular use 2 or 3 times per week helps maintain balanced mineral levels in muscle tissue and supports overall mobility. For long-term cramp prevention, this natural remedy remains a trusted, non-invasive solution. 3. Chamomile tea. Chamomile tea contains dozens of active plant compounds that work in harmony to relax muscles and calm the nervous system. One of the key flavonoids in chamomile, apigenin, binds to brain receptors that promote calm and reduce nerve excitability. This can lower the frequency of involuntary muscle contractions, particularly in older adults whose nerves become hypersensitive with age. Unlike over-the-counter muscle relaxants, chamomile works gently without sedating the body or creating dependency. Seniors who drink chamomile tea daily often report fewer nighttime cramps, as the tea helps balance the overactive nerve signals that cause sudden muscle tightening. The relaxing effect of chamomile also improves sleep quality, which plays a hidden role in cramp prevention. Poor sleep disrupts hormonal balance and electrolyte control, both of which are vital for healthy muscle function. When sleep is fragmented or shallow, the body becomes more prone to stress-related muscle spasms. Chamomile promotes deeper, uninterrupted sleep by increasing GABA activity in the brain. GABA is a neurotransmitter that slows nerve signals and helps muscles stay relaxed during rest. Seniors who struggle with both sleep and cramping may find this dual-action benefit especially helpful in improving their nighttime comfort. Chamomile also affects how calcium is managed within muscle cells. Calcium triggers muscle contraction, but it must be tightly regulated to prevent cramping. If calcium channels remain open too long or close too slowly, the muscle stays in a contracted state, leading to pain and stiffness. Some compounds in chamomile help modulate these calcium channels, encouraging a faster return to a relaxed state after contraction. This cellular-level effect supports healthy muscle rhythms and prevents the prolonged tightening that often turns into painful spasms. For older adults who experience frequent or long-lasting cramps, this subtle regulatory effect is especially valuable. Over time, chamomile reduces the chronic inflammation that contributes to muscle sensitivity and fatigue. Inflammation in older muscles can build up from years of overuse, poor posture, or circulatory issues. Chamomile reduces the production of prostaglandins and cytokines, which are molecules that cause pain, stiffness, and swelling in tissues. By calming this background inflammation, chamomile makes the entire muscular system more resilient. This helps not only in preventing cramps, but also in improving general muscle flexibility and comfort during daily activities. It is a simple, natural addition to the evening routine that offers both immediate and long-term relief for seniors prone to cramping. Now, let's dive into hydration strategies that support healthy muscles and reduce cramps in seniors. Many seniors underestimate how quickly mild dehydration can trigger muscle contractions, especially in the lower limbs. As the body ages, its ability to signal thirst becomes less reliable, and fluid balance is harder to maintain. A daily intake of about 1.5 to 2 liters of water is generally recommended, but this must be tailored based on kidney function, diuretic use, and other medications. Some seniors may benefit from smaller, more frequent sips rather than large volumes at once, especially those with heart or kidney concerns. Tracking fluid intake with a simple chart or mobile reminder can be useful for those with memory challenges. When cramping becomes more frequent in the evening or after mild exertion, it often signals low hydration that may not show obvious symptoms during the day. Beyond plain water, consuming moisture-rich foods throughout the day can contribute to daily hydration needs in a gentle and flavorful way. Cucumbers, watermelon, citrus fruits, and broth-based soups are easy to digest and offer a steady release of fluids. Bone broth, in particular, adds not only water but electrolytes like magnesium, calcium, and phosphorus that assist in neuromuscular balance. These foods are especially useful for seniors who struggle to drink enough fluids due to dry mouth, difficulty swallowing, or reduced appetite. Combining hydration with nutrition ensures that the body doesn't lose electrolytes through urination without replacement. Eating these foods between meals can also prevent post-meal dehydration, which is common in older adults. Some seniors may also benefit from adjusting the temperature of their fluids to encourage better absorption and comfort. Lukewarm or room temperature water is often easier on the digestive system than very cold drinks, especially for those with sensitive stomachs or acid reflux. Adding natural flavor enhancers like lemon slices, cucumber, or mint can subtly increase fluid intake by making water more appealing without added sugar. In cases where seniors are on fluid restrictions, hydration can still be supported with small servings of electrolyte-balanced beverages tailored to their medical needs. Personalized hydration strategies are especially important in warm climates or during illness, when fluid losses may increase unnoticed. Even mild dehydration over several days can disrupt muscle contraction and lead to persistent cramping if left uncorrected. Timing is also critical. Seniors who drink too much late in the evening often experience interrupted sleep due to nighttime urination. However, stopping fluids too early can lead to low-level dehydration by bedtime, increasing the chance of leg cramps. To manage this, it's helpful to distribute fluids earlier in the day, finishing the last full glass about 90 minutes before sleep. If needed, a few sips of coconut water or a hydrating herbal infusion like hibiscus tea can be taken before bed to maintain hydration without overloading the bladder. Finding this balance reduces both nighttime discomfort and cramping risk. It also prevents over-reliance on quick fixes like electrolyte tablets, which may not suit every senior due to sodium or potassium content. Now, let's explore evening nutrition tips that support muscle health and prevent cramps. Many nighttime cramps are connected to drops in blood sugar or a lack of magnesium and potassium during late hours. Seniors who skip dinner or eat low-nutrient meals in the evening often go to bed with depleted reserves, setting the stage for muscle spasms. Including a light, balanced evening snack helps maintain nerve and muscle health while also supporting blood sugar stability. A banana with a spoon of almond butter offers both magnesium and a steady release of glucose. Pumpkin seeds mixed with a few raisins or oats cooked in almond milk deliver complex carbohydrates with trace minerals that support nighttime recovery. These foods gently nourish without spiking blood sugar or burdening digestion. Processed snacks, salty crackers, or sugary desserts may seem comforting at night, but they can actually dehydrate the body and disturb mineral balance. High sodium intake encourages fluid loss through urination, while excessive sugar can increase nerve sensitivity and create fluctuations in insulin that affect muscle performance. Seniors often crave such foods out of habit or emotional comfort, but even small servings can contribute to cramps when eaten late. Instead of abrupt changes, gradual swaps, such as replacing chips with roasted chickpeas or cookies with fruit and yogurt, can lower the cramp risk. Teaching this shift in habit makes evening nutrition work in favor of restful sleep. Herbal teas with calming and mineral-supportive properties can further enhance evening nutrition for seniors prone to leg cramps. Chamomile tea, for example, not only relaxes the nervous system, but may also help with magnesium absorption when consumed after dinner. Adding a pinch of cinnamon or a drop of honey enhances both taste and metabolic stability without spiking sugar levels. Tart cherry juice, taken in small amounts, provides natural melatonin and potassium, supporting both sleep and muscle function. These beverages work best when consumed about 30 to 60 minutes before bedtime, helping to regulate internal balance gently. For seniors with medication routines at night, these additions can complement, not interfere with, digestive and sleep rhythms. Including this kind of nutritional hydration as part of an evening routine can improve both muscle control and sleep quality over time. The timing and composition of the evening meal play an equally important role. A dinner that's too heavy, high in simple carbohydrates, or rich in saturated fat may cause indigestion, reducing nutrient absorption. When magnesium or potassium isn't adequately absorbed, muscles lack the fuel needed for normal contractions. Seniors who eat as early as 5 p.m. may also need a second light snack by 8 p.m. to avoid long fasting windows. This small habit change can help regulate blood sugar and keep the muscle cells stable through the night. Adding nutrient-dense but gentle foods in the evening allows the body to repair, restore electrolyte levels, and sleep without cramping interruptions. Let's discuss daily movement and activity tips to help prevent leg cramps. Many seniors unknowingly fall into long periods of inactivity throughout the day, even if they feel generally mobile. Prolonged sitting or resting without changing position can reduce circulation to the lower limbs, leading to stagnant blood flow and increased tension in the calves or feet. This can trigger muscle cramps, particularly at night, when circulation naturally slows down. Encouraging short bouts of walking, 5 to 10 minutes after meals or during TV commercial breaks, helps maintain blood movement and keeps muscles supple. Seniors using walkers or canes can still engage in these movements at their own pace to prevent joint stiffness and muscular imbalance. For those with mobility limitations, chair exercises or gentle movements performed while sitting can offer significant benefits without strain. Simple ankle rolls, leg lifts, or even toe flexes repeated regularly improve local circulation and reduce muscle tightness. Chair yoga routines, designed for older adults, include slow, controlled movements that support balance, flexibility, and calm the nervous system. These can be practiced in groups or alone using online guidance, making them accessible regardless of location. For seniors with arthritis or joint discomfort, warm-up routines in the morning can prevent stiffness that contributes to daytime cramping. Consistency is more valuable than intensity. It's better to move in small amounts throughout the day rather than rely on one long workout. Seniors benefit from integrating movement into everyday tasks, such as walking while brushing teeth, stretching while waiting for the kettle to boil, or balancing briefly on one foot during kitchen tasks. These micro-movements stimulate blood flow and encourage muscle engagement. Regular activity also boosts endorphin levels and supports better sleep, indirectly reducing the likelihood of nighttime cramping. Over time, this kind of consistent physical engagement helps the muscles remain oxygenated, loose, and less prone to spasms caused by sudden changes in position or temperature. Next, we'll cover important symptoms to watch for when leg cramps get intense. Frequent leg cramps in seniors are not always a harmless nuisance. They can signal early changes in circulation, nerve function, or electrolyte regulation that shouldn't be ignored. If cramping becomes regular, especially during rest or sleep, it could point to reduced arterial flow or nerve compression in the lower spine. In some cases, cramps may be an early sign of peripheral artery disease or diabetic neuropathy. Seniors often downplay these symptoms, but consistent nighttime cramping deserves medical attention. Monitoring patterns like timing, severity, or associated numbness helps distinguish benign muscle fatigue from underlying conditions needing professional care. Sudden changes in cramping frequency or intensity may also reflect medication side effects or imbalanced nutrition. Diuretics, often prescribed for blood pressure or heart issues, can flush out potassium and magnesium, directly contributing to muscle spasms. Likewise, low calcium levels from parathyroid disorders or inadequate dairy intake can intensify cramping episodes. Seniors who experience cramps soon after starting new medications or dietary regimens should consult a healthcare provider to adjust dosages or add mineral support. Dismissing these signs may delay the identification of imbalances that grow worse with time and affect muscle and nerve stability. When cramps are accompanied by leg swelling, skin color changes, or warmth in a single area, they may indicate more serious vascular issues like deep vein thrombosis. While cramps alone are common, combining symptoms could mean a blood clot or nerve compression problem. Seniors with a history of clotting disorders, immobility, or varicose veins should pay close attention to any new or persistent cramping sensations. Even minor symptoms like a persistent tingling sensation or sudden weakness in the leg can provide early clues about spinal nerve pressure or arterial narrowing. Identifying these signals early allows for targeted intervention before long-term complications develop. Before we wrap up, ask yourself, are you ready to take control of those leg cramps and say goodbye to restless nights? If you found these tips helpful, please give this video a like, and don't forget to subscribe for more natural health solutions. Have your own remedies or experiences? Drop a comment below. We'd love to hear from you. Thanks for watching, and here's to stronger, healthier legs every day.